Hi, everyone. Welcome to the webinar, Strategies for Strengthening Family Childcare, Using Data to Inform Policy Change. A few housekeeping items as we get started. This webinar is being recorded. All phone lines have been muted because of the high number of participants. To the right of your screen, you will see a technical support pod. This answers some common questions related to audio and visual issues. Below that, you will see a chat pod. Please use this pod for questions and comments throughout the call today. We do have your name and organization from when you registered, so we do not need you to enter that information again here. And with that, I will turn it over to Laura Johns.
Thank you so much, Sarah. Good afternoon, everyone. I'm Laura Johns, the Project Director for the National Center on Early Childhood Quality Assurance. We shorten that up a little bit here and call it the ECQA Center. I'm really excited to see the over 310 participants on today's webinar and to hear about the roles that you are playing as you're voraciously typing into the chat box. The varied roles of people who are concerned and thinking about how to help and support family child care providers is wonderful. So welcome, everyone. Please don't hesitate to put questions in the chat box. We are very, very good at getting back to you via email and making sure that we get your questions answered and providing support to you. So the ECQA Center supports states and community leaders and their partners in the planning and implementation of system-wide approaches to health, safety, and quality in all early care and education settings for children from birth to school age. Our center's expert staff uses a variety of coaching approaches to really help your state, territory, or tribe in advancing strong health and safety standards and licensing regulations that align with the Child Care and Development Fund and Head Start performance standards. We really want to provide support to you as you develop and revise your policies and your practices so that they're culturally and linguistically responsive and responsive to the different settings that child care happens within your state, territory, or tribe. We want to make sure that we are always available to be thought partners with you to support the development and enhancement of your state quality initiatives, including your quality rating and improvement systems. And we're really always available to help you think through the enhancements of your quality assurance systems. We know that through the use of technology and data analysis and research, each one of you are committed to promoting a continuous quality improvement cycle and really committed to creating efficiencies and innovations for early care education systems. Our session today will provide a high-level overview of family child care. We're going to explore strategies for understanding your family child care population, and we're going to introduce 2 technical assistance opportunities to help states, territories, and tribes in understanding, reaching out to, and engaging family child care providers, and identifying supports and services that can help to improve the access to and the sustainability of family child care. But before we get started, I'm really pleased to welcome Shannon Christian to open today's webinar. Shannon serves as the Director of the Office of Child Care at the Health and Human Services Administration for Children and Families. She previously served as the Associate Commissioner of the Child Care Bureau at ACF, where she advanced President Bush's Good Start, Grow Smart Early Childhood Initiative. And she shaped the office's research agenda to better support state policy and spending decisions. Shannon is committed to effective prevention strategies. She oversaw the launch of Illinois' home visiting program and was an active board member of Be Strong Families, a Chicago-based nonprofit. Earlier in her career, Shannon was part of former Wisconsin Governor and HHS Secretary Tommy Thompson's welfare reform team, serving as head of the planning section in the State Health and Social Services Department's Office of Policy and Budget, and as a senior advisor to the Secretary of Workforce Development. Shannon, we are so excited that you're joining us today to share information about a topic we know you care very deeply about, and we're so excited to have you as a major champion for work around family child care.
Thank you, Laura, and thank you all for including me on this important topic. It's a delight to see it getting this kind of attention. For those of you who don't know, Laura Johns is our new superhero who's leading the Early Childhood Quality Assurance Center. We had to say goodbye to Nancy von Bargen. It's a very challenging post, and Laura's already off to an amazing start. So I think that between all of you and Laura and that team, we have great things ahead. Family child care, as you all know, is an essential piece of our mixed delivery system for child care in the United States. And every day, parents across the country rely on family child care, which I'm going to call FCC just to save syllables. So, and they rely on that, so FCC, so they can go to work and to school. Nationally, about 1 in 4 children, 25% who are subsidized through the Child Care and Development Fund, CCDF, are cared for in family child care settings. We know that family child care is an important option for a number of reasons, including families seeking infant and toddler care, parents with non-standard work hours or variable work schedules, and the care of children with special needs. It's also the personal preference of many parents for a variety of reasons, from trust to preferring home-like settings to culture and language. And often, family child care is the only type of care available in rural areas. Yet, despite its critical role, the number of children receiving CCDF subsidies in family child care has steadily declined from 2011 to 2016. Family child care serving CCDF children dropped by just under 146,000 during this same period. This means we have fewer child care options for families receiving CCDF funding support. There have also been family child care losses in the general child care market. In fact, licensed family child care providers dropped by 40 to 45% over the last 5 to 10 years, depending on which data we're looking at. So back to this call. For all of us who care about state child care systems building, it's important that we understand this unique provider population and develop strategies for outreach and assistance to family child care providers. Together, we can improve the quality of care and ensure that families in a variety of circumstances continue to have viable child care options. So I encourage you to take advantage of the technical assistance offered to states, territories, and tribes and continue to work to identify supports and services that can help improve the access to and sustainability of family child care. Now, I'll turn it over to Zelda Boyd with the ECQA Center for the next slide. Thank you.
Thank you, Shannon, for giving us that context for today. Good afternoon, everyone. I'm Zelda Boyd, and I'm the Quality Assurance Specialist at ECQA Center, and I will be facilitating the webinar today. And joining me today are my two colleagues from the ECQA Center, Michelle Adams and Nina Johnson, who are going to share more about the strategies for understanding your family child care population. But before we get started with that, we want to start with a poll. We want to hear from you. We're interested in knowing what brought you to this webinar today and what questions you have about family child care. So please take a moment. Sarah has put up a poll and respond, selecting your top priorities from the list of questions. And I just want to please have you note that we have in the questions for you to select your top priorities for your state, but we also are hoping that you understand that we're wanting you to do that for your state, territory, or tribe. We'll give you a few moments to do that. So as the numbers are coming in, it looks like quite a few people are really interested in looking at their state and local policies to support and sustain their existing family child care providers. I think that's probably our top answer. So Sarah, we'll give it about 2 more seconds and then we'll go ahead and close the poll. So thank you all for participating in that. Again, it looks like most of the people on the call are really interested in looking at your local and state policies and how they can support and sustain existing family child care providers. So we're going to get right into our discussion today, and Michelle is going to share a little bit with us about why families prefer to use family child care. So Michelle, tell us a bit more about why families are choosing family child care.
Thanks, Zelda. We know that parents choose family child care over center-based care because it provides a number of advantages, such as a home-like setting that's compatible with the cultural and linguistic preferences of the children and their families. Family child care also provides the opportunity to develop that one-on-one relationship with a single caregiver over time. They offer flexible hours, including extended weekend and nighttime care for parents with non-standard work hours. They're often located in neighborhoods that are close to the family's home. This also helps reduce transportation barriers. Family child care homes have the ability to serve mixed age groups, which allows siblings to be cared for together. And children often enter care as an infant, and they're able to stay through the elementary school years. This provides a great continuity of care for children. And in many communities, the caregiver is often thought of as an extended family member and a guiding influence. Families may also choose family child care as it's often less expensive than center-based care. Child Care Aware of America reported in 2018 that the national average annual cost of care for a center-based program was $10,408 compared to $8,889 for family child care. Despite these advantages and preferences of families, as Shannon said, we know that the number of licensed small family child care homes has decreased. It's decreased by 19% between 2011 and 2014. The number continued to decrease by 20% between 2014 and 2017. The reasons for the decline are not fully understood, but we have anecdotal survey responses that have been reported to us by state that cite the economy, changing demographics and low enrollment, increased provider requirements, and providers aging and retiring from the profession. All of these were cited as factors contributing to the decrease. We also know that family child care providers struggle with additional challenges that are really unique to their business. These include meeting the daily needs of children in a small group setting. If they care for mixed ages, it's not easy to plan activities for both infant, preschool, and school-age children all together in the same group. Understanding and complying with multiple and often conflicting states of standards and regulations is also a challenge. Isolation that comes from being the single caregiver, and a lack of access to information and resources that may be helpful to the caregiver in improving their business practices and supporting the families that they serve. And lastly, the burden of conducting business in their own home presents great challenges for balancing the demands of that business with the demands of their own family. One way that states and territories can better understand and begin to strengthen family child care is by conducting a policy self-assessment. The ECQA Center has developed a tool that will guide states through a series of questions that will help them determine whether they have the infrastructure that they need to pursue supply building strategies to meet the needs of families, and if they have the data that's needed to fully understand the state's family child care framework. This self-assessment tool also helps in examining policies that can impact the availability and quality of family child care, such as licensing and monitoring policies and policies related to quality rating and improvement systems, professional development systems, and the child care subsidy system. The self-assessment tool also walks states and territories and tribes through a review of their existing supports for family child care and their outreach strategies. Sarah has posted a link to the tool in the chat box, and we, based on your response to the poll question, it sounds like this might be a great resource for many of you.
So Michelle, thank you so much for really reminding us of the important role that family child care plays in our early childhood landscape, and also reminding us of the vast number of challenges that are faced by family child care that may have an impact on the decline. But it's also exciting that we have this new tool that we can look at what's happening in the state. So can you give us some more examples of policies that may impact the family child care provider and some outreach strategies?
I'll share a few that we pulled from the tool, Zelda. A state, territory, or tribe can examine whether their family child care policies meet the needs of that diverse group of providers that they may be serving, including English language learners and those with limited resources. For example, the self-assessment tool will ask questions such as, are your licensing application materials available in languages other than English? And do the language skills of your licensing staff match the languages spoken by providers? Another great question is the cost of becoming licensed or being monitored reasonable for the typical family child care providers in your state, territory, or tribe? And has the state addressed common barriers, such as the limited flexibility that providers have in their work hours, limited access to internet, and multiple languages that may be spoken by providers? Those are just a few of the examples of questions that are included in the self-assessment tool.
That's great, Michelle. And how about some examples of some existing efforts to support family child care and outreach strategies?
Well, to approach this question effectively, states, territories, and tribes really need to take time to understand the needs of their population, the population that they're trying to reach out to, and to consider strategies and policies that are right for them. The tool will help states do this. And most importantly, states, territories, and tribes need to include family child care providers when developing plans, resources, and support systems that will impact them. This is something we learned early on when working with our peer learning group participants. You must bring family child care providers to the table, and I thought that was an important lesson that we learned early on. States can also identify existing supports that are designed to serve family child care providers, such as family child care networks, shared service alliances, home visiting and mentoring programs, child care associations, and partnerships with early learning programs, and encourage all of these programs and services to work collaboratively. And that oftentimes takes time and effort from the state, territory, or tribe to bring those entities together, but it can build efficiency and improve effectiveness.
That's great, Michelle, and I really appreciate you saying just the importance of bringing the family child care provider to the table to be involved and looking at the things that are impacting family child care. Who better to speak to that than the provider? How will the assessment help the states, territories, and tribes strengthen their family child care?
Well, at the conclusion of the self-assessment, a state, territory, or tribe will better understand their strengths, the challenges before them, and the opportunities that they have. And they'll be able to identify the gaps in the information and the needed support. They'll be able to set goals and priorities for systems building, and they can outline the next steps for moving forward. We had a number of states that participated in our peer learning group and found that the self-assessment tool was really very helpful in helping them gather the information that they need to have a better understanding about family child care.
Thanks, Michelle. And we will make sure that everyone on the call will get access to those materials and some more information about RTA as we go along. But for right now, I want to bring Nina into the conversation. Nina, can you tell us a little bit about what we know that good data can help inform policy change? How does that happen, and what types of data are useful, and where can we get this information?
Yeah, so the types of data that are useful, come from various sources. So data that you collect through your subsidy program, like the type of care that families use, whether they use it during non-traditional hours, the ages of children who use the care, and the characteristics of the families will be useful and will give you a better understanding of the need for care. Data from licensing on the number and capacity of providers is also useful, and data that you have from licensing or the CCR&R or other sources on the characteristics of providers are helpful as well. You might also be interested in learning about providers through surveys, about their motivation for providing care, how long they've been doing it, how long they plan to do it, their challenges, et cetera. And data on the cost of providing care can help you better understand some of those challenges. And although we're talking about homes, it's helpful to gather information on centers too. So for instance, you might want to know whether they limit the number of children receiving CCDF whom they serve, whether they serve children during non-traditional hours, and whether they serve infants. And this will provide a fuller picture of the supply of care. And then census data can help you learn about more about the demand for care. You can also get a sense of the economic climate in communities by looking at things like median family income and vehicle ownership. These different data sources can tell you quite a bit about supply and demand, especially when you look at it over time, which is really important to see how trends are changing and in different areas of your state or territory or tribe or community.
So Nina, we know that we do collect a lot of data in various different elements about family child care and other services that we offer. Tell us a little bit why it is important for someone to analyze, and why would someone want to analyze their family child care data?
Yeah, I noticed that quite a few people, when they responded to the poll at the beginning of this webinar, noted that they were interested in looking at their family child care data more closely. And I think there are a few reasons for this, and you all may have others that you want to share in the chat box. For one, in order to meaningfully support providers, it's helpful to better understand their needs and the dynamics at play. And then also, it's really easy to generalize the family child care population, when in fact family child care providers differ quite a bit, both within a state and even within a community. So understanding these differences is as important as understanding their similarities. And also, this is important as well, having data can often lend credence to initiatives and help secure funding.
That's very true. So what questions might be answered with the data a state or territory or tribe or community already has access to? What questions could they answer?
Yeah, so I feel like this is the fun part. And if you all have questions that you want to answer with your data, feel free to type those in. I think it'd be an interesting discussion to have in the chat box. So to better get a sense of the supply of childcare, you might be interested in learning about changes in the population of providers over time, specifically zeroing in on different areas of your state. For example, you might ask if the number of providers has declined more significantly in rural areas or in urban areas or in certain communities within your state. You might be interested in asking if there are any correlations between the decline and the characteristics of providers, like language spoken. You could ask questions about the ages of the children that providers serve and whether they offer care during non-standard hours. Or you might be interested in looking at family child care providers' participation in activities, in quality activities and support programs. So that might include the QRIS, professional development opportunities, and the Child and Adult Care Food Program. And then to get a better sense of the demand for child care, you might be interested in learning more about the characteristics of the families who receive CCDF. What are the ages of their children? What type of child care are they using? Are they using more than one arrangement? Do they receive care during non-traditional hours? Do they have a child with a disability? What is their primary language? Another really interesting question is, do they live where their child receives care, or do they travel outside their community? And you can look at that data by combining your subsidy data and your licensing data. And with census data, you could ask what percentage of children with all parents in the labor force are in any given county or census tract, and then compare that to the number of providers. Because while it's interesting to look at the CCDF data, we know that there are many other families out there that are using family child care providers who are not receiving CCDF. So census data can be helpful with that.
Great. And I know, Nina, just listening, that list can seem overwhelming. It can be like, oh my goodness, how can I gather all this information, and then how can I break it down? So tell us a little bit of how would someone begin the process of even analyzing that data.
Yeah, so it would be important for a state or community team to come to an agreement on what questions they have about family child care. What do they want to learn about the family child care providers in their state or community? And then to begin thinking about the data they currently collect and whether they could use their existing data to answer their questions, or if they need to collect some additional data. And it would be helpful to work with a data analyst to help ensure that the data is consistent and makes sense. It's important to continue asking questions throughout the process. And then teams may decide to do this on their own, or they may decide to partner with researchers. And on that note, I'm excited to share that our center is partnering with Child Trends to offer support to a few states or territories that are interested in learning more about their population of family child care providers. And that support would result in a data story, which combines and compares data in new ways and presents compelling data visuals. That story might support internal planning and decision-making, or be public-facing and used to articulate why improvements to the family child care system are needed. And ultimately, we hope the analyses are used to better tailor support to family child care providers.
Thanks, Nina, for that great information. We do have quite a few questions in the question box, so I'm going to ask Nina and Michelle if you would just give those a quick look, and maybe we can answer a few. I think we have some time remaining.
So Zelda, it's Laura, and I was really interested in Barbara's question about supporting older family child care professionals and encouraging young educators to move into family child care. And I think this is a really good question when you're thinking about sustainability and growing your supply. And one beautiful thing about family child care is for that person who is trained in early care and education and supporting young children, but also is very interested in business and entrepreneurship. Family child care, it provides an excellent opportunity for you to run your own small business and think about skills that you have around grant writing and accessing federal and state dollars to support your families. And so I think we need to always have the conversation with our colleges and universities and technical schools and our city about, when you're talking to people in your classroom about their career potential, that there are people who teaching is not everything they want. They also want to be the owner of their own business. And then family child care makes the most sense. So I think one way to support this is to have your lead family child care providers who are aging out of the system become mentors to younger people through partnerships with colleges, universities, and their maybe some programs that provide internships. and pair people in family child care homes for internship, your apprenticeship programs in your state. Are we making sure that we have placements for apprentices in family child care homes? And how are we communicating the opportunity of being a small business owner to people who are entering our field?
Okay. That's great to think of it that way, Laura. I know oftentimes we think of succession plans for child care centers, and we really don't think about the aging population for family child care providers. So that's a great question, Barbara, and Laura, thanks for that response. Any other questions we have time to cover?
This is Nina. I just want to note it's really exciting that people are sharing the types of initiatives that they're working on in their states and communities in the chat box. And I see that some of you have already begun the process of looking at your data and addressing issues around childcare deserts. So this is great. It's a great opportunity to share with one another.
And then I want to go, this is Laura again, I want to go back to Barbara's other question around transportation. And I want to remind us of the lessons that we're learning from the Early Head Start Child Care Partnership and our shared services initiatives across states in thinking about transportation for families. Transportation is a tricky issue, but it is a great issue to tackle in a shared service alliance where there are multiple family child care programs and neighborhood family child care programs who don't want to take on the insurance and liability issues of transporting children, but can hire a company that specializes in that. And again, Head Start has really thought about transportation and utilizes transportation. So I think we want to listen to the lessons learned from our Head Start partners about how they've tackled that issue from a liability and cost standpoint, from a logistics standpoint. So I think that's a great thing for us to continue to explore.
And Tony asked a question about when we talk about child care deserts, do we include family-friended neighbors who are providing care? And I think what she's getting at is we may know about the family child care providers who are listed, so they may be either licensed or participating in the subsidy system. But for those who are not participating in the subsidy system, who we're not aware of, how do we understand the kind of gap that they fill? And I think that's an excellent question. So it sounds like some states are including them to the extent that they can and the extent that they know about them. But it would be interesting to know how other states are understanding where family-friended neighbor providers are and who they're providing care to and what communities if they're not a part of the formal system. And then the other thing I would just say is if they're not a part of the formal system, then they're likely not getting the supports that they maybe could benefit from being a part of the formal system. And so how do you reach those providers?
That's really, really interesting, Nina, to talk about it that way. And I want to say to Heather, I wanted to mention to Heather on in your question, I don't know if there's someone on the call from the State Capacity Building Center, but if there is, I think it would be great to pose this question about preschool development grants and what states are working on family child care issues around in the preschool development grants. And Alejandra at the State Capacity Building Center is doing a lot of coordinating work with technical assistance providers around preschool development grants and could probably help us put together even just a short, one-page brief that gives some examples of what states are doing around family child care so that we can learn from each other. So we'll pass this question on to her to see if we can get some more information for you all around preschool development grants and family child care.
Laura, this is Michelle. It looks like Catherine asked a question about the drop in home ownership and whether that contributes to the drop in the number of family child care providers. And I think that that's a very interesting question, and that might be a good one to explore when you're looking at your data within your state, and certainly policies related to homeowners associations that may put restrictions on businesses and homes is another good thing to explore. And certainly the economy impacts folks' ability to purchase their home or to rent a home that allows care to be provided in the home. So I think that's a good question that we need to explore more. And it may vary depending on the state and location that's answering the question.
Yeah. And to look at Cheryl's question around how do you engage your college university program, as a former college professor, one of the things that I valued the most was when my state early care education agency contacted me, or I could contact them to bring in guest speakers. And so if you know that you have a nearby college university who's teaching that foundational introductory to early care and education, it's one of the 101 courses you take, or if you know a CDA provider who's providing a CDA course, invite yourself to come and be a guest speaker. No one will speak as passionately as each one of you on this call. So invite yourself, say, hey, we have a shortage in this area. I'd love to come and talk about family child care and the opportunities that are available to your students as they're graduating, as you're thinking about internships. So I think sometimes we have to invite ourselves to the table and then lean way in. And so I would really encourage you to do that. Again, professors love to bring guest speakers in, and no one better than you all on the phone to do that.
I think we have, I'm just checking to see if we have any more questions in the chat box. This has been a great conversation.
And Zelda, I wanted to respond to Gemma's, I hope I'm pronouncing her name correctly, in California, because I do think you're correct about this idea that home ownership is lower, and this idea that people are co-living in multi-generational or roommate situations to save money, which makes it very challenging to work through background checks and things like that. So I think you're right that these are all contributors to the decrease in the decline.
I'm just giving a few more moments because we do have time, and I don't want to cut off before we get everyone's questions answered if we can.
So I think Nicole and a lot of you are writing in about examples from your state. And I think one of the things that states can always do to support the national centers who are providing technical assistance is we love to hear these stories. I don't know if Shannon is still on the call, but there are many, many times when we are
I am here.
Oh, yay. So when you're doing something innovative and you're launching something and you're trying an experiment, we want to know that. We want you to write something up. We want you to give us the contact number of that person, because I can't tell you how often Shannon says, do you have a good example of that? Or can we get that person to speak on a plenary? So please, everyone, we never take the time to celebrate the big wins and the small wins. And there are many more strengths in our early care education system, and specifically in our family child care system. We're always talking about the deficit. So please, as you're exploring and trying new things, just drop us a line, put it in an email, send it to us, let us know who the contact person is, write up a blurb. It's always great to have your state administrator in your state vet that to say, yes, this is how we want to represent our state. Submit it to us, and then we would love to use it in a paper or in a best practice, or to send it to Shannon for something to her to share. I think that's really important. So please do that. And if you're wondering, I don't even know who my state administrator is, you can ask us that question and get in touch with us, and we'll put you in touch with the right people to make sure that everyone is on the same page with the stories that your state is telling.
It's Shannon. I completely concur with that. And states and everyone would rather learn from each other, somebody who's doing it, than hear stuff from us. So when we can feature projects that are going well that came from the state or local level, it just means so much more to the audience.
Great. And I know we still have a little bit.
Go ahead.
I know we still have a few more minutes, and I'm again continuing to be interested in some of the things you guys are bringing up in the chat box. So Massachusetts is a state that uses the union system, a voluntary system in Massachusetts for family child care educators. And I do think it's probably worth us thinking about bringing together a cohort of states who are all have a similar tie to unions, because I think you could have some conversations and share some information that could be supportive of your work. So if that's of interest to you, please let us know, and we can try to do some peer-to-peer calls. Again, we vet all those through your state leadership, but I think everyone's really interested in engaging you in peer-to-peer conversations. And I love Cheryl's question about the role of families and parents. And I think, our quality initiatives in our state are really working hard to think about consumer education and the role of the family in not only being an advocate for high quality, but also for driving policies and procedures at the state level and regulations at the state level to support quality. So think about how you can be involved in your quality rating and improvement system in your state, which is really a system that helps inform parents about quality and helps parents really think about the choices they make for their children in family child care. But any of the other quality initiatives that you have around family engagement would be ways to really think about how we can further engage our parents. Nina, I'm wondering if you saw Nancy's comment and wanted to comment on Nancy's comment.
Yeah, so Nancy said that they see a relationship between regulatory changes and family child care registration, and as the bar is raised, the number of providers has declined, and does national research indicate this to have a correlation? So I can say that national research, as was highlighted at the beginning of this webinar, indicates that the family child care supply has decreased. But, it's hard to say. It's hard to point to a specific cause. So I think it's important for states to look at their data and do some research and interview providers and get a better sense of what the actual cause is, because we know there are many contributing factors. And yes, I think that could be one, but it could be one of several.
I'm going to just kind of switch gears from some of the questions that we've moved over to our question box and address a question that's come up a couple of times in our chat box. We do have a second webinar that is going to really dig deep into some work that the Quality Center has done around the decrease in family child care. And I know that is such a hot topic. That webinar filled up in less than an hour, which is really exciting. So here's the plan. We will go ahead with that webinar on the 25th, and we will tape it and put it online. And then if you are interested in having us provide further information, we're going to do some regional phone calls in partnership with our regional program managers who want us to come on and talk to their states. But we also, if we need to put in another session, we are happy to do that. We are excited that you're excited about this topic, and so we will make sure that we, if we need to, provide a second webinar for that.
Laura, I also wanted to point out that we have a number of resources that are available on the Training and Technical Assistance website, and we can provide that link to folks as well. We've grouped all of those resources for family child care onto one website or web page, and we'll be happy to share that information with folks too.
And thanks, Juliet, for posting the link to the National Study of Family Child Care Network. The Family Child Care Network system has really, really worked, frankly, just to make it short and sweet, where family child care providers work together to support their industry and their professional development and their shared services work, and where states have really put an emphasis on making sure they create the space and the supports for family child care through these networks. So thanks, Juliet, for posting that link to that important research. And Cheryl made a comment to everyone saying, if you're working with refugees and non-native English speakers, especially in family child care settings, she would love to get a group of people together to talk about that. And we, again, one of the things I think we do really well here at the Quality Center is host communities of practice. And if this is a hot topic for states and you're a state lead, your state administrator and their team at the state, think that's something that your state would be really interested in, we're happy to engage in that conversation and try to support you with that.
I think we have time for about maybe 2 or 3 more questions, and I see we have a few more in the chat box, so we'll give another 5 minutes for that, and then we'll start to move toward our closing.
Juliet shared that they'll continue to explore, they got a grant to continue exploring the decline in family child care, so we're very excited to hear that. Gaining that additional information will be important to many states and territories, and now is the time that they need that information. So thanks for sharing that, Juliet.
And so a lot of the things that you're asking about regarding support for linguistic diversity and your families who are non-native speakers and more work on family child care networks is really helpful information, because we're gathering this data from you. We're interested in what you're interested in. And so we will try to put together some responses to some of these questions, but also think about how some of your questions might develop into future webinars coming out from our centers or peer learning communities or communities of practice. So thank you all for continuing to provoke us and help us think about what we could be offering that could be supportive to your needs.
I think the other thing that I would just add, this is Nina, about supporting providers who speak different languages is that the language is important, and it's also the culture of the providers that's important as well. So I think that when you're looking at supporting culture and equity in family-friended neighbor care, thinking about every single piece of it, from training and hiring staff to developing relationships within the community, the practices that you're using, language obviously, and understanding the nature of the care and the provider's needs.
And I actually live in Georgia, where we have a great example of one of our resource and referral agencies who provides a host of services for non-English language speakers who support family child care and our family child care providers. So as you're thinking about what support you can put together for these providers, definitely think about how you are leveraging your resource and referral agencies, your technical assistance providers in your state, and how are you giving them and helping them with the capacity that they need to provide support services on a regular basis to your providers.
Nina, Laura, and Michelle, thank you so much for answering the questions, and thank you all and our participants for posing your questions. And as Laura said, we will continue to look at the questions. Hopefully we've gotten to the majority of them, and we so appreciate that you are sharing with one another. We know that everyone is on mute because of the number of people we have on the line, but we appreciate you using the chat to communicate with each other. So now we're going to, I think, Shannon, if you're still on the line with us, I want to give you an opportunity if you have any closing remarks. Shannon may have needed to jump off the call. Okay, so we're going to look at one. Okay, so we're going to talk about our RTA opportunities that we'd like to share with you. I mentioned earlier when we first started that we do have some opportunities and we were going to share that information with you. So the ECQA Center is currently providing an opportunity for states, territories, and tribes to further explore the concepts discussed here today or to really develop your own data story. So those of you that are registered for this webinar will receive an email describing the individualized TA opportunities available from our center. We do encourage policymakers and service providers to contact us if you're interested in understanding the family child care landscape in your state, territory, or tribe, or if you wish to explore strategies that can help you retain your family child care providers in the field. You can access and complete the interest questionnaire at the link in the email that we will be sending you, or you can reach out to us directly for technical assistance tailored specifically for your needs in your state or territory. So we also invite you, and as Laura said, many of you were saying, mentioning about the second webinar. So we are inviting you, if you have already registered, and if you have not, we are going to make that recording available to join us April 25th at 1:30, that's Eastern Time, for our next webinar, where we will take a deeper look at the decrease in the number of family child care home providers and strategies that states, territories, and tribes can take to help improve the access to and the sustainability of family child care. You also can find some additional resources from our center on the website, and that link is there in our presentation. And so I want to take a time again to thank our presenters and thank you as participants for joining us today. And we hope to see you in a future webinar. And this concludes our webinar. But before jumping off, we just ask you to do one final thing so that we can better understand what your needs are, and that in the future that we can better meet your needs. We ask that if you take a moment to just answer our poll questions. We do take this very seriously because it helps us gauge what we need to do to make sure that what we present is meeting your needs. And these polls will stay up for the next 3 to 5 minutes. Thank you.